everyone. I am very pleased to have the opportunity to present development of global perceptions among nursing students in Japan. Next slide, please. The International Council of next slide, please. The International Council of Nursing declared the cultural linguistic competence in 2013. ICN believes that nurses should demonstrate cultural competence by developing an awareness of one's own culture without letting it have an undue influence on those from other backgrounds. Demonstrating knowledge and understanding of different cultures. Accepting that there may be differences between the cultural beliefs and values of the healthcare provider and the client. Accepting and respecting cultural differences. Adapting care to be congruent with the client cultures and expectations, and providing culturally appropriate care so as to deliver the best possible client outcomes. So ICN believes clients have a right to culturally and clinically appropriate care delivery provided by the appropriate person in the healthcare team. Next slide, please. Thank you. This slide shows the number of registered foreign residents living in Japan from 1990 to 2019. The Japanese government relaxed the regulation for foreigners entering into the Japan due to the shortage of labor. There were 2.93 foreign residents in Japan in 2019. Next slide, please. This slide shows the foreign residents by country. The number of residents from China, Vietnam, and the Philippines have been increasing, while residents from North and South Korea have been decreasing year by year. Next slide, please. The figure on the left shows the birth rate in Japan, which has been decreasing rapidly since the 1970s. The number of newborns was 848,350 in 2020. The figure on the right shows the number of newborns where one parent is a foreigner. This has been increasing since the 1990s. Medical professions, especially midwives, public health nurses, and nurses were required to develop their competency of maternal child care for foreign parents and their children. Next slide, please. The elderly population, 65 years and older, has increased. There were Japanese war orphans who returned to Japan from China. Koreans who came to Japan before, during, and or after Second World War II, since Japan occupied the Korean Peninsula from 1911 to 1945, and foreigners known as newcomers who came to Japan after the end of the 1980s. These people can manage basic interpersonal communication skills, but lack cognitive academic language proficiency. They prefer lifestyles they cultivated when they are young. Nurses are required to provide information on the long-term care system and interpret for them during provision of care and to respect and understanding their cultural background. Next slide, please. International nursing aspect in basic nursing education in Japan have been established by the acts and regulations for Educational Institute of Public Health Nurses, Midwives, and Nurses. It emphasized that fostering nurses' abilities to think at the level of international cooperation with broad perspectives with the international community. The division in January 2008 emphasized that international nursing subject be included in nursing management and disaster nursing integrated and implemented in nursing. In 2019, it was revised with more global aspect, understanding issues of healthcare and welfare in other countries. Next slide, please. The first nursing diploma course was established in Japan in 1885, and the first degree course was established in 1952. Though the number of degree courses is increasing, 75% of nursing education depends on diploma and certified courses. International practicums have, however, been relatively lacking in nursing education programs in Japan. This is not only due to a shortage of nursing educators, but also because there has been an increasing number of educational institutions developed for nursing professionals. Next slide, please. The Committee on the Ideal Way of Nurturing Nursing-Related Human Resources and the universities declared Nursing Education Model Core Curriculum in 2017. Globalization will increase opportunities for nurses to provide services to foreigners residing in Japan and to practice trans-border nursing, such as healthcare activities in other countries. It is important to gain understanding of such diverse contexts while acquiring specialized knowledge necessary to practice nursing to meet the needs of diverse patients while recognizing the complexity of each context, taking the characteristics of each patient into account. Next slide, please. The Nursing Education Model Core Curriculum, A73, the roles of nursing in the international community and diverse cultures. This has objectives to run the roles of nursing professionals in the international community and diverse cultures. Academic goals are to understand the current situation and challenges in healthcare and welfare in the international community. To understand the necessary abilities for supporting the lives of people with diverse cultural backgrounds, and to understand the health-related challenges and strategies in the international community, and gain the ability to discuss the future roles and responsibilities required of nursing professionals. Next slide, please. We developed a curriculum to cultivate global perceptions for students through the National College of Nursing. Next slide, please. Thank you. In the third year, students enhance their abilities to develop awareness and consideration of factors, socioeconomics, natural environment, culture, health systems related to health issue with multiple perspectives by theory in global nursing, and based on abilities. Students enhance their knowledge of health issues in the world and international cooperation, and their abilities of nursing activities with transcultural perspectives by seminar on global nursing. In the fourth year, based on those abilities and knowledge, students are exposed to health problems of foreign residents during the Global Nursing Practicum 1. Further, Global Nursing Practicum 2 are conducted in other Asian countries. Next slide, please. Students' outcomes of Global Nursing Practicum 2 in out-of-country Asian countries. Student perception of benefit of Global Nursing Practicum or nursing activities are personal growth, cultivation of international perspective, increased understanding of nursing, beginning of expansion of views on nursing activities, and interest in exploring the essence of nursing. And student expectation and achievement for Global Nursing Practicum or development of compassion, experience only in the practicum field, inspiration from achievement from Global Nursing Practicum, and living experience outside of Japan. Student has anxiety. That's environment, individual ability, and inevitable events in developing countries. However, individual ability and inevitable events in developing countries are reducing after practicum. Next slide, please. Consideration and future recommendations. Global Nursing Practicum is an effective education method for basic nursing education and an earlier exposure or fostering internationalism. We have to understand the willingness of students and take their anxiety into consideration so that they can enhance the goal of the subject. All subjects related to global aspect have to be integrated depending goal of the student's competency in each academic year so that they can develop their abilities to provide quality of care for people. Cultural perspectives are essential for nursing activities. Students should recognize equal value of all cultures around the world. Next slide, please. It is important that a strong collaboration between government, universities, and hospitals be developed immediately. Cultural competency programs be required as a part of on-the-job training. Health staff should conduct case conferences regarding foreign patients and discuss patent issues with foreign residents to help them develop their health knowledge. Next slide, please. Thank you very much for listening.